So I'm excited to bring this conversation to you today and want to introduce our first speaker. Our first speaker is Dana Blackwell. Dana Blackwell serves as Senior Director of California Strategic Consultation at Casey Family Programs, CFP. In this role, Dana is responsible for leading CFP's work in the state of California to include statewide partnerships, initiatives, and systems improvement activities. Good morning, Dana.
Good morning. Thank you, Jess. And thank you for everybody who's joining us today. Welcome to the final forum of the 2022 Comprehensive Prevention Plan Learning Series, Putting It All Together. And before I do my opening remarks, I do want to acknowledge Caltrans, CDSS, and Implematics for making this series this year so successful. Without that partnership, Casey would not have been able to bring you sort of the depth of information. So thank you for your partnership and your willingness in this endeavor. When we initially contemplated and designed this series, we did so with county support in mind, right? So how do we help counties, one, think through, envision, and design a CPP that is responsive to families and communities? And two, how do we provide guidance in a way that makes the plan development straightforward and attainable? I think we've done a good job over the past 6 months in providing a framework through the readiness domains and curating local and national experts to provide consultation and direction on plan elements. The Caltrans website holds all of the resources from the learning series that you can and should reference as you begin to write your plan. Stephanie dropped a link earlier with those resources in one place, and we'll be referencing those resources again later in today's forum. Additionally, and I think most importantly, there is the implementation guide. I encourage you all to really go through the guide, as it is intended to be a how-to, a manual, if you will, that will help you walk through the development of your plan. And in that guide, you will notice that we have created the wheels for you, right? Tools, templates, and work products that help you pull together all of the required elements of your CPP plan. We've got a communication toolkit in there, right? That has infographic, it has messaging, it has PowerPoints. No reason to recreate the wheel. There is a set asset mapping and service array frameworks, fiscal impact frameworks, right? It is there for you. And more than that, there is a video with chapters to walk you through each section of that implementation guide, which correlates to each section of your CPP. As we close out the 2022 learning series, we are in plan development for the 2023 learning series. And we have dates already identified. And here's the schedule. I want to thank all of you for providing feedback at the end of each forum about what worked and where there was room for improvement. We have listened and are incorporating your feedback into our series design. With that, let's get to today's forum, putting it all together. Today, we will focus on strategies for effectively drafting your CPP and how to develop a CPP that facilitates and supports readiness and implementation. And our two experts today that will be presenting, first is Jennifer O'Brien, Policy Fellow at Chapin Hall at the University of Chicago. San Francisco is where I graduated from. And Cheryl Treadwell, Branch Chief of the Safety Prevention and Early Intervention Branch of DSS. And so with that, I will turn it over to our moderator and esteemed colleague, Kush Cooper.
Thank you, Dana. Good morning, everyone. I am it's one of those, we're coming to the end of one part of this journey. And we want to leave you today with not only a sense of, okay, I have what I need to take me through the finish line for this phase of it, the planning phase of it, but that work that I did also sets me up for 2023. And that's what I hope to leave you with. You won't necessarily understand all of how yet, but that's the way I invite you to listen today. So here's our agenda. I will turn it over shortly to Jennifer O'Brien, who's going to talk to you about how are you, that governance structure that we have been harping on you to create, learning forum in, learning forum out. Well, now it's time to start to engage them in the development, review, and approval of that CPP document. And Jennifer's going to talk a little bit about how that could go, and some tips about who to have in the room and how to organize yourselves. After that, we'll move to Cheryl, and Cheryl will talk about the CPP submission mechanics and resources available to you with regard to the mechanics of that submission, and some contexts or lenses through which CDSS is going to be viewing these plans. Cheryl will share a little bit of that with us. We'll take a break around 11:30, and then at 11:40 we'll come back and I will share with you, okay, so here's where you should be approximately, right? And here's where you are. Here's how where you are will position you for implementation. We'll review some of the tools that Dana mentioned in the context of the things you need to do now so you can write a plan. And then we'll open it up for Q&A with a few polls designed so we can understand what kind of tools have been helpful for you and how we can fashion our learning forum tools for 2023. We hope to wrap up at 12:50 or sooner. And we have a little cushion in there, and by 1, this learning forum ends. Okay, so before I turn it over to Jennifer, I want to just talk to you about what goes into this completion of the plan development phase of final, our final goal is implementing a comprehensive prevention services program, but what goes into this plan completion phase? Like I alluded to earlier, engaging your governance structure, not only for the development and writing, but also for signature and submission. Getting signatures and getting them timely so you can meet your submission deadlines is actually something to be thought through before you meet some of those roadblocks that can come locally. How are you going to communicate this CPP that you've developed or are developing to community stakeholders? So how are you going to communicate to them about the process for development, the process for feedback and input, and a walkthrough of the content? The mechanics of submission, who's writing it, who has the master document, who's assigning sections to write, is it on a shared drive somewhere so we can collaborate? Who's packaging it and sending it to CDSS? Who's crosswalking it with the template they have, which Cheryl will show you later, to make sure some of the guiding questions are accounted for? So the mechanics of submission. Then the CPP, the submission of the CPP is a preview, in essence, of the program you're going to implement. And so it'd be really great if all the work that you did to create the CPP actually began the blueprint of your implementation plan and program. Right? So we'll just talk a little bit about how to view the CPP, not only as this plan that has to get submitted so the funding continues, but also our blueprint for implementation. And then in general, part of this area is all the approaches, methods, and tools, some of which Dana alluded to, that are used during the CPP process. And how can you use those same tools to generate momentum for implementation? Implementation of what? Implementation of this service array for this target population that you've submitted in a plan to CDSS. Right? So those are all the parts of this phase, all the sets of activities that you are about to or are already engaged with. So with that, I'm going to turn it over to my colleague, Jennifer O'Brien. Jen, welcome. And over to you. Let me know when you'd like me to advance.
Sounds great. Thanks, Kush. Good morning, everyone. As Kush said, I'd like to share some insights and strategies when engaging your governance structure and your local partners to complete your comprehensive prevention plan. What you see on the screen here are a couple of strategies that I want to walk through over the next 30 minutes. So we're going to talk about drafting the CPP, facilitating a review process, capturing and incorporating feedback, and last but not least, very exciting, obtaining signatures. Okay, let's move on. So how do we approach drafting? One more slide. CDSS has put out 2 great resources to help you organize your thinking and inform the drafting process. Let's spend a few moments discussing how these can help organize your planning and your agenda setting for your governance structure. Notice this slide is directing us to that supplemental information guide. And on page 2, you can access the capacity assessment and implementation guide. So first, the capacity assessment. Everyone invited to participate in your governance structure needs to clearly understand your focus is on developing a prevention infrastructure or enhancing your existing prevention infrastructure. It all depends on where your county is in that spectrum. You'll want to identify key partners and community members with social capital that are already prevention minded. Decide who the initial invite should come from. Some invites might need to come from a director. Other invites might need to come from the FFPS lead in your county. And still other invites may need to come from community members inviting other community members to the table. Most important, make sure your initial outreach clearly articulates the goal. We are coming together to draft our county's comprehensive prevention plan. Let's talk a little about the implementation guide. This resource provides a great work plan and can really help you set agendas for your governance. For the first meeting, you might want to ask all of your stakeholders to share why this work is important to them and whose voice and perspective they represent in the process. If you listen carefully and capture what the stakeholders share, you can use that content to begin to craft a shared vision. Another huge objective and critical piece of the work is to identify the geographic location of assets throughout the county. Who has contracts or is already delivering any of the 10 EBPs included in the California Prevention Plan? They will be your critical partners. When mapping your assets, make sure to gather existing capacity. This will come in handy when also conducting the gap analysis. Let's take a moment to flag a unique opportunity you don't want to lose track of as you plan your governance structure tasks. You are developing a comprehensive prevention plan. California has made it possible for you to go beyond the family first specific EBPs. Said differently, you get to explore what the community wants you to explore. Some of my colleagues at Chapin Hall researched and developed a slide deck describing the economic and concrete support strategies being deployed throughout the country and the evidence base behind them. This resource can help generate ideas with your community. Again, it's another one that's linked in the supplemental document. Okay, let's talk about the data that you're going to need. You're going to need team members in your governance structure who can easily pull data within your county to help you understand the needs of the potential target populations by age. Let me say that again, the needs by age, because your EBPs are specific to those age ranges. So think about your structured decision-making tool or your CANS data or whatever existing assessments you're using. and how they can help you estimate how many youth have mental health or substance abuse needs, how many parents have mental health, substance abuse, or parenting skill needs, and where they're geographically located in your county. Matching the interventions to the needs is another agenda item. So once you have the SDM or CANS data broken out by age, you can begin to align the EBPs. You can match the needs with the age ranges and select your array. Remember earlier, we gathered the geolocation and the capacity of the existing EBPs. That data can now be aligned with the needs of the parents and the youth to identify gaps. Let's move on to the next slide, Kush. Okay, ACL 2223 identified the required partners to engage in the governance structure and drafting process. But let's break this down a bit. What does it mean to be included in the drafting process? You're going to need to identify your primary author or authors. That might be your FFPS lead in the county. It might be hired consultants that you brought on to help with writing. It might be a team approach of subject matter experts. All of those are valid options, but you need to clearly make sure you know who is going to play that role of primary author. You'll also need those subject matter experts across your departments. And you want to think about training, CQI, contracts, fiscal, and communications as some of those key bodies that you need, or representatives. And don't forget to include a representative from your mental health, your substance abuse, and your parenting skill contract holders. This will likely be your DMH, your DPH, possibly even your DPSS. And finally, stakeholders. Those listed here on this slide and those on the next slide, and we'll get to in just a second, along with your subject matter experts, are likely your first and consistent reviewers, right? Your subject matter experts and your stakeholders are your consistent reviewers. Hold on to that thought. We'll say more about the review process shortly. But before we move on, let me speak briefly about one of the required partners depicted here: parents and youth with lived experience. We all have been working diligently to try to figure out how to pay individuals with lived experience, how to incorporate their voice and their presence at all of our decision-making tables. But there's a couple of best practice thoughts that I wanted to make sure I shared with you. So best practice is encouraging us to designate a team member, somebody on your FFPS team, to help prepare the individuals with lived experience for meetings, answer their questions during meetings, regularly check in between discussions, and debrief following meetings. They will feel empowered and contribute more throughout the process if they're supported in this way. Okay, let's go on to the next slide. Beyond the list of required partners, you also want to consider inviting the partners depicted here to join your governance structure. Remember, the Department of Public Health might be a primary contract holder of your home visiting EBPs, as well as your substance abuse EBPs. The Department of Social Services may also have home visiting contracts, but you'll want to explore their eligibility criteria. For example, there may be a strict asset gap that needs to be explored. Community-based home visiting, mental health, and substance abuse providers. Okay, so this one can be tricky. If you need to issue an RFP to establish or expand providers, insider knowledge and unfair advantage could be a problem. You may want to elicit input and feedback from providers when drafting your vision and your logic model, but seek guidance from the contract holders, DMH, DPH, DPSS, when you're trying to select the array of interventions. That'll help you avoid that conflict of interest. Okay, one more entity on this slide that I want to address. If you have an equity or disproportionality office, they will have critical data to inform the selection of the service array and help you understand the service gaps within your county. Make sure they have a seat at the table as well. Okay, next slide.
Jen, I failed to mention something earlier, and folks may be curious about something. So let me just go back and
Okay.
do that. So this slide is an example of one that has an image in its. So you'll see some of the slides. This one has a number 2 with this what looks like a little home plate in the top left right-hand corner. That number is associated with a resource or a tool on the resource page that's been provided to you. So just wanted to fail to mention that earlier and wanted to bring that to folks' attention. Thanks, Jen. Here we go.
No problem. Thanks, Kush. Okay, so the next four slides all follow the same format. So at the top of each slide, I've identified subject matter experts that should be tapped to help accomplish the depicted tasks. So we've been talking about identifying key partners to engage in your governance structure throughout the last 2 slides. Hopefully, you've already begun this engagement process. Regardless of where you are, though, a key best practice is to craft a charter and a vision for and with this group. Make sure to include the information you gathered from stakeholders during that initial convening, where they all shared why this work is important to them and whose voice and perspective they represent. These will help make up the individual responsibilities of your charter and, again, help you shape that vision. You'll want to create a roadmap and a timeline to inform each stage of implementation. The capacity assessment and the implementation guide are excellent resources to inform your exploration process and your installation process. Once you submit your CPP, you need to revisit that roadmap. It will help you then begin to align the tasks that carry through installation and move you to initial implementation phases. This is where you're crafting policy, you're enhancing and implementing training, you're preparing for and launching pilots or demonstration projects. When you're ready to expand the pilot beyond your initial site, you're moving towards full implementation. The communications subject matter experts that you bring to the table can take that roadmap, can take that timeline, and craft updates that help you prepare the workforce and the community for what's coming when. Let me also remind everyone of the CPP Communications Toolkit that was recently posted. It provides a wide array of talking points, some awesome infographics, and strategies to engage various audiences. Don't lose sight of that resource. Make sure it's brought to your communications SMEs within the county so that they can tap into that and build off of it. Okay, next slide, Kush. As your governance structure takes on the task of selecting a service array, the subject matter experts will be county departments who hold the contracts of the EVPs, individuals with lived experience, and community members who can tell you what resources, what supports, what interventions are needed to prevent abuse and neglect. That's what we're trying to do ultimately. A few minutes ago, I provided an overview of the implementation guide. Bear with me while I highlight again the important resources needed to identify your CPP service array. When you select the target population, you really need to look at data. Partner with your IT and your CQI offices to pull that historical data of youth and parents' needs. The SDM and again, the CANs might be helpful resources here. Pull the demographics, know information about these families, the age, the race, the gender. Look at the geographic location. Where are these families? Where are these individuals located? And you'll want to do that for the following populations. You want to look at those who are requiring historically emergency response investigations, those who are served by your family maintenance staff or voluntary family maintenance, those who have entered foster care, and those served by your probation department. All of this data is going to help you understand historically who needs what, where, right? And that's what we're trying to align and match up here. Next, meet with those who hold EVP contracts throughout your county to determine existing capacity and geographic location of your service providers. These are your assets, guys. These are your assets. Where do we have interventions How much capacity do we have? Where are they located? Overlay those assets with the geographic location of your target population, and you've got your gaps. You start to see clearly where you do not have interventions for families that have historically needed those interventions and match up with them. Finally, take those matched services and needs and select your array of EBPs. This is a great start to identifying the secondary and tertiary interventions of your comprehensive prevention plan. To determine your array of primary interventions, this is where, again, our community members and our individuals with lived experience are going to really benefit from having strategic conversations with you, facilitated dialogues about what are the economic, what are the concrete supports that we know we need in our communities to help us decrease the incidence of abuse and neglect. Finally, when you move to developing your logic model or theory of change, I'm partial to logic models, folks. In this instance, my reason is, think about what we've just gathered. The process you went through, selecting your target population, identifying your assets and gaps, and selecting your service array are all inputs, right? Your STM, your CANs, your geographic data, the interventions, those are all inputs for the first side of your logic model. And remember, at the start of your governance structure, you're asking individuals their vision for the needs of the community. That vision starts to help you figure out what your identified impact areas are. So your logic model starts to come together very nicely based on these tasks. Okay, let's go on next slide. Okay, now that you have your array of interventions and know the gaps to fill, you can partner with your fiscal, your training, and your contracts subject matter experts to outline your CPP spending plan. A link to the CDSS local spending plan template can also be found in the supplemental document. As Kush referenced, that little baseball mat with the number 3 up there is telling you what page to go to. Remember, each cost needs a sustainability plan. Each cost in your comprehensive plan needs a sustainability plan. Don't leave that out. As you develop your spending plan, consider what resources or funding streams could be applied now. Maybe it's the state block grant funding, and what streams will be applied later. Maybe it's the Title IV-E reimbursement. Key tasks include identifying the cost for any consultants and payment for individuals with lived experience, training cost and service cost to expand or implement each of the primary, secondary, and tertiary interventions that you've selected. One more piece. On the primary side, if you selected economic or concrete supports, also consider in your spending plan funding a participatory evaluator or researcher to monitor the outcomes and further the evidence base. If you're looking for a resource to help determine the potential cost per family for any of the EBPs, the Chapin Hall Evidence-Based Practice Cost Exploration Tool, long name, sorry for that, is also hyperlinked in the supplemental document. And that's a really good resource to take you through the machinations of figuring out what's the cost going to be per family of any of the EBPs. If you don't already have that, check out that resource. Okay, next slide, Kush. All right, this is the last slide in this section. Operationalize service quality, also known as developing your training and your CQI plan. A comprehensive training plan, folks, should consider the needs of both internal and external staff. Your service providers and your contract holders are going to benefit from an overview of FFPS and the comprehensive prevention plan vision and logic model. Those are great places to start. Whereas your internal veteran and new hire staff will need to be trained on FFPS, the eligibility criteria for each of the services, the referral process, and any other documentation and policy enhancements. We've got one more resource here that might be helpful. in this supplemental document, and it's called a CQI measurement framework for implementing and evaluating prevention services. Within that framework, it suggests 4 measures or 4 areas to determine if the prevention services are reaching and producing the desired outcomes. So what are those 4 areas? First, capacity. It helps you assess the degree to which you devoted the necessary resources. Do you have enough capacity to provide the services to all of those referred? Reach is number 2. Ensures you track the number referred, the number served, and the number completing services. That's your reach. Fidelity is number 3. How well is the service being carried out? And the last one is your outcomes, the impact of the services. All of those are outlined in that resource, and there's some really great processes to take your team through when you're developing that CQI plan. Another key resource to measure impact is your ongoing assessment. Don't forget that SDM, the CANs, those are valuable resources throughout this process. Each target population in your CPP is going to need an initial assessment to determine what their mental health, their substance abuse, and their parenting skill needs are, and then help match services. Following that, the ongoing assessment will inform decisions to close a case or extend services. And finally, what good is a CQI system without a feedback loop? Fidelity and outcomes data are going to need to be shared with contract holders, with providers, and with funders. When data suggests we're struggling with capacity, reach, fidelity, or outcomes, the contract holder will need to be developing action plans with the provider to improve practice. Okay, let's go on to the next slide. All right, we're going to move on to the review process. One more slide. Depicted here are a few best practices when creating the workflow of your review process. Earlier, I mentioned the importance of identifying your primary authors, your subject matter experts, and representatives and designees from each stakeholder group. It's quite possible that these folks have helped form your CPP leadership team. As the primary author drafts content, the leadership team will review and help enhance the draft. This process should occur for each and every element of your CPP. Once the initial draft is ready for external review, you want to ask each member of your leadership team to elicit feedback from their colleagues. Remember, they're all there representing various voices. So you automatically have that next level reviewers in whoever the individual's colleagues are, wherever they go back to for either work or for ongoing collaboration. So you need to select a dissemination process. You might craft a worksheet to accompany the plan, setting the parameters of the review. This is important. For example, did we meet the state's requirements as outlined in the ACL? If no, what enhancements do you recommend? At this point, you're not looking for track changes to every single sentence in your document. I would avoid sending a Google Doc or a shared drive version to the masses. Instead, a kind of guided worksheet or template that asks them to provide you feedback, but really also just make sure that you're meeting the requirements as outlined by the state. Okay, next slide, Kush. Remind reviewers, you guys, this is your county's 3-year comprehensive prevention plan. There's gonna be opportunities for you to enhance and strengthen your plan in the future. You're never gonna craft the perfect plan according to everyone, right? Instead, request specific insight, focus their attention, and ask for feedback to be shared in a manner that they would want to receive feedback if they were in your shoes. We all know what that means. And we all know who it can be tough to get feedback from. But if we approach this process in that manner, hopefully you'll get through it unscathed. Okay, next slide. So we established a process to capture the feedback. Now we want to go about incorporating it into the plan. Okay, I'm stealing shamelessly again here from best practice approaches when incorporating feedback. And we see 3 steps: digest, incorporate, and make a revision plan. If you provided reviewers a worksheet, create a master file. Copy and paste feedback that comes in from each reviewer into a single row of that element. Look for patterns. What do multiple reviewers agree on? Tackle the small scale suggestions, get those handled, but then identify action items or content that your leadership team or your subject matter experts or your stakeholders will have to review and decide what to do with. Finally, don't forget to track your progress as you go. These are your checks and balances. Okay, next slide. Last step before submission is obtaining signatures. This process can take a while. There's likely a formal review process that includes the director and members of the exec team. And if your plan is being jointly submitted with child welfare and probation, you might be on the hunt for 2 signatures. Be prepared for at least a month-long process. And if you get a signed doc back in 2 weeks, you can pop the bubbly a little early. I highly recommend finding someone within the director's inner circle to help you shepherd the CPP through the final review and signature process. I also recommend building a week in after you get it back for any final content revisions. Last minute feedback, we all know, can be a beast if you haven't planned for it. And with the John Hancock secured, again, that bubbly should be on ice, right? Pop it and know that we'll all be toasting with you. Okay, the next step is submission. So with that, Kush, I'll turn it back over to you.
Thanks, Jen. So there you are. You've done the things that Jen has outlined, and you've taken this plan through your governance structure, and it's signed, and it's ready to go to CDSS, right? So we're going to have Cheryl take over and talk to you about that part of the process, at least what is known thus far. Cheryl?
Thank you, Kirsch, and thank you, Jennifer. That was great. You lifted up some really useful strategies for counties in terms of how to prepare their plan. So I'm going to try to talk a little bit about the mechanics of some of this submission and just provide some insight on a few other concepts. Next slide, please. So you've seen this slide before. Remember this graphic? It sort of is a depiction of how we envisioned your pathway forward for the submission of the plan and getting it into the implementation phase. So if you look at the lollipops, you look at the neutral lollipops toward the end. You know, it may feel like you're standing still, but if you're there in this process, you are making progress, and understand that this is a gradual process. And for some of you, it might be a sprint. So for some of you, it may be a marathon, but know this, you're right where you need to be. And that is why I think with all the resources and the support that we are offering, we're hoping that we are reducing some of that anxiety around, do I have all I need to move forward? Next slide, please. So I'm just going to recap a few things, and you will hear themes throughout the presentation today between Jennifer and myself and others that just sort of bear repeating. You know, we're talking about a comprehensive plan, meaning that you're looking at all levels of prevention and the primary, secondary, tertiary services. But one thing, I know there's been a question that has been asked, you need an evidence-based practice in each tier. You don't. We require that an EBP is included in your comprehensive prevention plan, but it's not required for each tier. So I just wanted to make that clarification. The other thing is that your strategies, as we said, we cannot emphasize enough, they should strengthen and support. It's imperative and it's important that you make those right community connections to help build the trust that you need so that we can avoid having children enter our system if they can remain in their homes. You know, this slide says that without agency involvement, basically we're talking about changing the relationship will be different with the child welfare agency that's involved. So as I said, where your heart is, where your treasure is, and you want to make those investments in the community so that you can have the variety of array of supports and services that families need. You should be intentional by supporting more of your community-based organizations. What do you mean by that, Cheryl? Well, advance them the funding now. Build that trust by putting that money where it matters and help them build the capacity that they need now rather than later. So that's important to remember. Next slide, please. I just want to say a little bit about the spending and budget plans that will be included with your comprehensive prevention plan submittal. Jennifer has already mentioned the tools that are available. You and your cross-sector partners, I believe it's very important for you to appeal to your local boards. Share with them the benefits of investing or redirecting funding early in the communities that are most impacted by the systemic institutional racism that they have been experiencing over the years. And the result has been a lack of services in underserved communities that has resulted in a lot of the populations to be disproportionately impacted in the child welfare system. 2 critical entitlements are part of your budget, which is the 4E money and the Title 19 Medi-Cal money. We have a great opportunity to expand prevention services with these 2 systems on a large scale. So whatever is built, we constantly say it has to integrate these 2 systems well in order for families to get what they need. It should be seamless and appear seamless to families. Key decision makers at the local level have to collaborate to make this seamless to the people that we intend to serve. Our joint guidance that we're working on now from a state perspective in terms of this whole payer of last resort will be forthcoming sometime next year. CBSS and the Department of Healthcare Services, we are working diligently together, and we received some great input from the field about the areas that we need to address in our guidance. Jennifer addressed the governance structures. I don't need to say a lot more about that, but just continue to lift up the benefits of working together with these spending plans needing to reflect all sources of your funding, and it's reflected by what the governance structure values as required with the required partners that are sitting at the table. Next slide, please. So in the plan, you will be required to attest to a few assurances. These assurances are required by the federal law and also by our state program. But we felt like this was the best way for you to demonstrate to us your commitment to agree to develop a lot of these areas. And also at the same time, we were trying to be sensitive to the fact that some of these areas are still yet to be fully described in terms in time for your submission of your plan. The list is pretty self-explanatory. The only thing that's on there is not mandatory is that we added an attestation that wanted your commitment to be grounded in the racial equity and diversity and inclusion framework. But the rest of these areas in terms of working on the safety monitoring, looking at your model fidelity and CQI, we know we still need to build out those areas. So we put these assurances in the plan so that we will make it easy for your submission and just have you be able to demonstrate your commitment in these areas. Next slide, please. So in terms of the submittal announcement, great announcement everybody's been waiting for. We are extending 6 months submittal process due date through July 30th. We will be issuing a letter and guidance that provides information about the extension, and also it will include in that letter at the same time how county may opt out in terms of opt out of submitting a comprehensive prevention plan. Of course, you can still submit early. We would like for you to, if you can. And then again, we don't want you to put the brakes on though, because we have added an extension. we recognize that it takes more time to build community engagement, to put your contracts in place, to do some of the work that was described earlier for Jennifer. So we're hoping that this 6-month extension period would also give you time to like ask us more questions in terms of what you need and take advantage of the available resources that we have put in place for counties to access. As we get, in terms of the block grant funding, as we get closer toward the end of that spending period, we will evaluate our options once we have more information about who is submitting, the types of questions and concerns that we are hearing around the funding. But we don't want you to put brakes on the money. We want you to spend the money. So that is one piece of information that I think people were waiting to hear about the extension. So I hope that makes your head. Next slide, please. So we created a template, and I know it just got released and posted. So there are questions in that template that are aligned with our ACL, and I think we're going to walk through it. Each section has guiding questions to prompt the development of that content. So it's going to take a quick. Yeah, this is located on our website. See their required signatures, who's submitting and what lead agency is submitting it to us, making sure that all these signature pieces are covered in the template. And as I said, these are guiding questions. They're not required. It's not like you need to take this template and attach it to your plan. This is just sort of the outline that you can frame your plan when you're writing it. This is what we would expect to see in terms of the key areas. And key areas are aligned with what we, as I said, outlined in our ATL or ATIN. So just, as you can see, there's questions here to prompt your thinking to get to the answers you need in order to write your plan. The required partners versus who you suggested, all the information around the tribal consultation, how the things you need to consider there, ICPM. So basically it's an outline, and you can use this template or not. So, but if you do not use the template, then the expectation is that you are covering these main areas in your plan. All right. Thank you, Chris, for sharing that. Next slide.
Yeah, and Cheryl, just it bears mentioning here that the implementation guide reflects the sort of order of logic in the CPP template. So when you pull it up, the first thing it's going to ask you is governance, and that part of the guide will help you answer these questions that Cheryl has put out in the governance section.
Yeah, thank you for making that connection, Chris. So here's a list of upcoming, this is a list of all the resources. She just mentioned the implementation guide. There's a lot of resources here, counties. Just take advantage of it. You have what you need. And so we want to be very supportive of you. So use these resources. We have an upcoming community-based organization webinar. I think that's a focused webinar that will be very useful in terms of building your community pathway prevention, working with your prospective partners. We have look forward to some model counties that are engaged and able to provide some examples of how they're working in their community. You see the flyer that's embedded here, and I think it's been dropped in the chat area. And I did mention earlier that the other area that we are providing, well, it's on this slide, I'm sorry. So we are providing tribal engagement, looking for expertise to help you engage with tribes in a more improved fashion for this work. And then also there's been inquiry for support in needs for small counties, looking at ways to look at areas that need to be tailored to those communities, and maybe building in some flexibility or looking at some flexibility around how the comprehensive prevention plan could be adjusted for small county development. We have a statewide convening coming up as well that will give more insight to the approach for building your comprehensive prevention plan. So here's just the mechanics about what's in the plan. The template and the spending plan are optional, but we do need your signature page that comes with the plan that's out of that template. So that signature page should come with your plan. We're going to assign a plan to a CDSS consultant and manager. We are currently working on our standards for the review of the process of the plan. It will all be grounded in, of course, what we've outlined in the template, what's outlined in our ACL, to begin minimally with that. And then once we receive the plan, you can expect that we will acknowledge receipt of that plan. Next slide. And just here's the information. We've probably been sending lots of questions to this inbox, so continue to send questions to this inbox for your benefit. That is all of my slides. All right. Thank you.
Cheryl, everyone, it's time for a break. I'm going to stop sharing and turn it over to Caltrin to take us to a soothing break.
Great. There was a question in the chat, though. Would you like to address it before or after the break, Kush? I can read it out for you.
We could go ahead and do it now.
Okay. So the question is there a specific document or link that states the FFPS available funds, specifically breakdown for each county?
So there are two county fiscal letters that followed ACL 2223. And we can take the break to go ahead and find the links to those and put them in the chat to answer the question. Any other questions?
No other questions. I think we're ready for the break.
Welcome back from break, everyone. We are going to take a slight detour from the agenda. And that detour is that given we've got some questions in the chat that are directly related to the section we just completed, I say we just address them now. Cheryl, most of them are directed at you with regard to the plan submission process. So if you are willing, we could just hit them now. Okay, so first question in the chat. If counties submit their plan early, how soon can they expect review and approval? It's a $1 million question, I guess.
No, I would hate to put a time frame on that right now. I mean, it really depends on the content and how deep your plan is. But I would say that we would get to it as soon as we can. So I'm not prepared to really say what that time frame would look like.
Thanks, Cheryl. For the counties who submit time, that's same question about the time frame. Next question. Is there an official announcement going to be sent to the counties to announce the new due date for the CPP?
Yes, we are working on that guidance letter now. That letter would also be combined with how counties can opt out of providing a CPP as well. Okay, so and it's my hope that we can get that letter out sometime next week if we can get it through our review process quickly. But yes, we formally will be issuing guidance.
Great. Thank you, Cheryl. That's all there is for now. We may get more, and then we can deal with those at the Q&A. Right. So let's bring it home here, folks. Share my screen. Okay, so in the project management world, and that's a world I traffic in addition to the world of social work, one of your main enemies is rework, right? Because rework takes more resources than you had originally allocated for your implementation within your plan. So what I'm going to talk to you about in the next few slides is how to make sure that the work that you're doing in the planning phase here, which will end with the submission of a plan, can just be moved into your implementation, right? So how are these tools that you're creating now that will also help you submit the plan, how can they be used to have a smooth implementation once that plan is approved? All right. So I'm going to share with you a little bit of the inside baseball, I guess you could say, that we use at Implematics. But this is, if we're working with you, this is the framework that is behind how we're moving you through an implementation, right? And if you sort of follow this spiral, because it's not necessarily a circle, we spiral and we revisit. If you follow this spiral, then the implementation becomes adaptive, as opposed to what? Well, as opposed to maladaptive, right? This implementation will actually be the thing that adapts you to the new way. And the readiness domains, and I'll talk about those in a moment, reflect these 8 areas. What's not reflected, but implicated in the background of all the domains, are what you see at the center of this diagram, which is none of this is going to work without what you could say is the hub of this steering wheel. And, Dana, you have been working with steering committees. You've been working with groups at the state levels, groups at the county level. What would you say about what you see about the costs and benefits of having or not having adaptive leadership?
Well, I think adaptive leadership is critical because adaptive leadership takes in the whole, not just the pieces individually. And as Jennifer talked about the development of the plan, she talked about different people having their eyes on different aspects of that plan development. Adaptive leadership is looking at the whole. And in this instance, I would say that the leadership and the governance body is looking beyond just the CPP, right? The CPP connects to many parts of your system. And so beyond the CPP, there is connective tissue that you need to build, right? We talked about the ICPM and how it is a critical piece of your CPP plan. When we think about FFPSA generally, there are 2 parts to FFPSA. There is prevention, and then there is the congregate placement piece. In California, we've been thinking about them separately, but it is all very well connected, and adaptive leadership is really key to understanding where those connection points are, so that the system and the vision of the system is implemented, right? That is what you're trying to implement, is a larger is a larger vision. And in this instance, the CPP is just one part of it.
Great, thanks, Dana. And just to echo the criticality of what Dana mentioned in terms of being the connective tissue. This is going to be a big change for folks, right? It is revolutionary in some ways, asking a child welfare jurisdiction to wonder about the social determinants of health. So there is anxiety associated with all change. And if adaptive leaders don't provide the emotional support and the change management required to move people from one peak through the valley through the next peak, all of this starts to slow down and get gummed up, and you're starting to wring your hands and go, gee, why is this all gummed up? And it's likely because there's some attention to be paid to adaptive leadership and change management. Thanks for that, Dana. Okay, so back to doing as less rework as possible, because when I talk to you all, nobody tells me that we've got plenty of time and we've got plenty of money. It's always the opposite. There's no time and there's no money. Well, if we have limited resources, we want to avoid rework as much as possible. So when we are assessing where someone is in an implementation of your comprehensive prevention services program is a great example of an implementation, we'll ask, okay, who's the governance group? And then there's a series of questions that we'll ask after that I'll share with you about how we know sort of, okay, this is where this group is and this is where this group needs to go next. So you'll see that arc of adaptive implementation, which is what we use for any implementation. You could ask us to help you implement a domestic violence program. You could help us implement a prevention program. And some of this is help us build a high rise. And implementation has to cover these domains. And so we've arranged this learning series and the implementation guide, and CDSS has been so kind to arrange the CPP template to reflect that arc of adaptive implementation. So there's as less rework for you as possible. So I was talking to you about the heuristic we go through when we assess folks' governance with regard to heading up an implementation. So these are questions that you should be asking yourself now, and this will start to locate you in what there is to do next. So the first question, well, have we selected a governance committee? Right? Have we said out loud, it's the prevention cabinet, it's the 2083 ILT, it's some hybrid, it's another group entirely, right? Have you selected it? Okay, so that's the first question we'll ask. If the answer is no, then stop right there, right? And you have to go select it and articulate the selection. If you say yes, then the next question we'll ask is, okay, have you convened this governance committee? Can you show me the agenda and the minutes for your kickoff? And we'll look for inside of the convening or the convenings, okay, has a vision and a brand been adopted for this thing we're implementing, in this case, the prevention program? Where is it? Can somebody point me to the vision? And is it generic FFPS? Are we branding it, the local family-centered prevention services program? Is there a brand? It's really helpful to have one. Then we'll ask, can you show me the charter for this group? Okay, so and folks will either be able to point to one or not. You could think that a charter is a luxury at this point, right? And it very well might be, because do you need a charter for your governance groups to be able to write the CPP? No, you don't. But I probably would run out of hands if I tried to count on hands how many times an implementation has gotten stuck because halfway through the implementation, one piece of the governance structure thought we were working on one thing or valued one thing, and another part of the governance structure thought we were working on something else or working off of a different timeline. And then we've got to come back together and diagnose where the miscommunication is. Where if there was a charter, all we do is say, okay, what did we say about it? Okay, and then we point to the charter and say, okay, well, we said this, so let's break the tie. And do we want to change it going forward? Right. So a charter's like a prenup, right? It'll save the marriage in the long run. And then, do you have data sharing agreements? And one of the ways we'll ask that is, well, have you picked a target population? Oh, and if the answer is yes, it's like, well, have you shared the, that profile or some folks that meet that target population with your sister agencies? And then we'll get either, well, yes, we did, or no, we can't because we don't have any data sharing agreements. Okay, there are data sharing agreements in your 2083 MOU, right? You could reflect those, but those are the things we sort of look for. So if you haven't selected a governance committee, that's the first thing you need to do. If you've selected them, convene them, and at least start to charter them. Charter, the word charter is in red here because there's actually a tool linked to the implementation guide that is a sample charter that you could just pull down and then replace the guidance content with content from your facilitated conversations. Okay. So then, next question. If you've convened your governance group, have you established a formal process for tribal engagement, government to government tribal engagement, right? And how's that going to work? Has the consultation happened? Will they be part of the existing steering committee? Is there another advisory body that your tribes will be part of that needs to be connected to your governance group, right? What's that process? Whatever those processes are, if you write them down in the charter, you're gonna end with less dissension later that holds up your implementation. Okay, next, done all that. Has this group approved the theory of change and logic model? Oh, well, if they haven't, then you're going to need to pause and go work on it. Because ultimately, this theory of change and logic model is the suitcase handle for your whole plan. Have you identified a writing team? Has this governance group identified a writing team? Is there at least high-level roadmap or timeline? And we've got tools for that. Just link to the implementation guide in the governance section. And do we have protocols in place for review, signature, and submission? Right. Other things we might ask, and we wouldn't ask this till further into implementation once the plan is approved, but do you have an implementation plan that ends with delivering a service? Right. And do you have a communication strategy and schedule to keep all the stakeholders informed the way Jen detailed earlier in the presentation, right? And there's some tool. You don't have to use the spreadsheet we've provided for communication strategy and schedule, but you should have one, right? Who are we talking to and when, and how do they like to be talked to? Okay. So in the area of governance, these are the activities in black and the tools in red. Those are what you should be working on, and you should be taking an inventory of where you are. For stakeholder collaboration, okay? Are the stakeholders reflected in your communications plan, right? Or are you just talking to yourselves inside of your organizations? Have you researched whether prior community engagement sessions have happened? So you're not asking the community again what they need, A, and B, so you're not reinventing the wheel and doing rework. Right? find them, find the notes. The community may have already said, here's what we need. Here's the kind of concrete supports we need. They may have told the Department of Mental Health when they were doing their MHSA sessions, ask the Department of Health for those recommendations or those notes, for example. Okay. Then, well, if you've done that, if you've engaged the community and you have data, at least initially you want to validate, you want to select a target population based on what you're learning, right? And you want to go back to the community. And so it'd be really great to have community groups that were already engaged to go back to rather than having to start from scratch, right? If there was an MHSA stakeholder group, can we convene them again and ask them, hey, based on what you said 2 years ago, we're thinking this target population, what do you think? And then once you do that, you go, and that's validated, you may come back to them and say, okay, given you validated our target population, we're thinking this service array strategy, or we don't know what service array strategy, what do you think? Right? So do you have groups you can go back to over and over the next few months and years? You should be able to point to how you meaningfully engage those with lived expertise, particularly those in underserved communities from where you keep seeing folks coming into your systems over and over, right? Disproportionate to age, disproportionate to ethnicity, disproportionate to race, disproportionate to like zip codes, right? You'd be able to point to, oh, well, our target populations were in those 5 zip codes. So we actually went to the neighborhood council in those 2 zip codes because they covered our section. Be able to point to it. And we ask folks at those neighborhood councils what we need, what they need, and we showed them what resources we have. Okay, and then of course, ICPM running throughout. You all have invested a whole lot in ICPM implementation. Use it. Okay. And then program design. Where should you be? What should you be doing now? Okay. You should have an idea. You should have at least a preliminary target population. Like, oh, look, I think it's 12 to 17-year-olds and their families from this ethnicity or from this geographical area that keep coming into our system. And when I look into their histories, I can see, well, their communities have no services. I can look to see when they were at risk or were struggling or were in crisis, we didn't give them anything. Or when they were at the door of the system, we didn't appropriately divert them and we brought them in, right? What is that target population? Because without that target population and knowing who that is, you can't build a service array because you don't know for whom. Okay. So do you have a target population and have you validated it? Okay. If you've done that, now you can start to assess, well, let's say that there's this group of families that are always at the door of our system. What could we have done before the family violence happened for them? That'll tell you what your secondary services might be needed to be. Same question for that group that we keep seeing at the door of our system. What could have helped them even before they were in crisis to not get into crisis so that their community could support them? And we didn't need services so much so to do that. Okay. So target population, what do I have primary? What do I have secondary? What do I have tertiary? Okay. And then get validation for that. And then put that all together in a logic model, right? Get together in your teams, your governance groups and say, okay, let's fill out this logic model. It'll show you exactly what you don't know. And it will actually also show you what you don't know. So that's what you should be doing now with regard to program design. And that logic model and theory change will become a blueprint. You could actually hand that to a consultant or an evaluator and say, here's the system that we're trying to create. Help us implement it, help us evaluate it. It's not busy work. It really will help. Okay, and then with regard to funding. what should you be thinking about? Well, if you've got a target population and you've got service array, okay, how am I going to pay for this and with what funds? Okay. You only have to really give a formal spending plan for your state block grant funding, and sort of if the state block grant isn't the only thing funding your service array, the other funding sources you're bringing to bear. Right? 4E, when we're ready to claim child specific services for 4E, when automation is ready, right? That's a capped entitlement. So you probably just need to say how many folks you intend to serve with what EBPs, right? And what claims that translates into, we will worry about when we're able to claim child specific. But so do you know how you're going to pay for this new service array, which has primary, secondary, and tertiary components? And given what it's going to cost, does this look like you're going to break even anytime soon by reducing the reliance on the deeper ends of care? And then being able to move resources further and further upstream? There's a tool that helps you analyze that. Okay. So those are the kinds of activities that if you're engaged, if you don't skip over them now, you'll have a shorter implementation later. And what do I mean by that? You'll have a shorter time between when your plan's approved and when your prevention system is considered operation. Yeah. Right. Well, that's probably enough. And I wonder, I hope folks with the announcement of the extension feel a little more like some of these best practices with regard to implementation, with regard to leadership, with regard to engaging your community, with regard to building a system that's going to get you your outcomes. You have more time to do that meaningfully now. So with that, I'm going to stop sharing my screen and I am going to open up the floor to Q&A about anything, any of our presentations, and anything regarding to pulling this all together. So, it's a pretty wide open floor, and I encourage you all to take advantage of it, because it's going to be, we're not going to have a Q&A session after this one. So this will be the last time, at least, you'll have this group together for the year before you see us all again in 2023. All right, Jess, what do we have?
Well, we do have a question from the crowd, but we thought we'd model this Q&A by asking the crowd a question first. We actually have a poll question. This is a poll question about planning resources. And if it's okay, we'll just go ahead and launch it now. So this question is, which resources have you used to support your planning? You'll see that there are quite a few options, and if you scroll through these options, you'll see at the bottom there's also one that says other, and if it's other, you can type it into the chat. So I see some coming through. This is multiple choice, so you can select as many that are applicable to you. And I see some coming through. It looks like we have about, call it a little over a quarter participation. So we'll wait until we get closer to 50% and then we'll share the results. All right, I know there's a lot of options. Don't forget, if anyone selects other, you'll want to select what that other is. You can put it right into the chat. Okay, I'll give you a couple more seconds to take a look at this list and select your options, and then we'll share the results.
And this is also supremely helpful to us folks so please do take the time so we can really customize what's coming to you all.
Absolutely. Okay, I'm going to end this poll and I'll share it, Kush, so we can all take a look.
Right.
And you can scroll through that, Kush, as well. If you scroll down the page, you could see.
Yeah, so interesting. So the Caltrin trainings and resources, 74%. Congratulations, team. And, you know, I can see why, having worked with you all for this year, really, really, really a bang up professional organization. Okay, so Caltrans trainings and resources, we've got your local good, we've got consultants, 60% of the folks who answered using consultants and the CDSS website and toolkit, really great. 50% using the capacity assessment or readiness assessment. Got 46% of folks, so about half of folks using the implementation guide. Okay, so the child, family, and communications, well-being communications toolkit, I see it's at 23%. And I actually noticed in some of the areas where I traffic that folks weren't clear what was there for them, and some of them had actually almost started to go and like engage their graphics folks to start to, you know, invent infographics. And I was able to say, wait, no, it's all there for you. You can just adapt it rather than starting over. So folks, it's super helpful, and your communications folks will thank you because I'm sure this is not the only thing they're working on. Okay. Okay, and then we can see lead agency support and the learning series, about 31%. Okay, very instructive. Thank you, folks.
And so we do have a question. And for those that have questions, please feel free to ask in the Q&A feature. It'll help us gather them all in one place. The question is, should counties wait to start the official request for proposal process until after the CPP is approved by CDSS?
Great question. Let's see. Well, I'll ask what the party. So Cheryl, and folks, my presenters, if you can come offline, because I think this is gonna be a little free flowing. So what, like in terms of the CDSS view, I mean, I'll give you my consultant viewpoint here in a moment for whatever that's worth. But you know, from the folks that guide you, Cheryl, what do you see about that question?
Well, I would say that I would say they should not wait, especially if they're clear on which community-based organizations, for example, that they're working with. I would think that would not change. So I think to the point where you have certainty around how you plan to engage your community with certain providers, that you should not wait. So I would recommend that they should start those RFPs early in the process so that they can be ready. So that's just sort of my early thought about that.
No. Jen, what have y'all been seeing across the country as folks sort of negotiate, you know, this tap dance between plans and RFPs and leaving enough time for RFPs, but you can't say anything and you have to be clean with the provider, you know, all that. What would you say about it?
Yeah, it is complicated, right? I think you see people that have lengthy RFP processes getting started, getting everything ready to launch, and then maybe hitting that go button once they've received approval. You know, the proposal development process, the checks and balances takes time. So I think don't delay that at all, but then we understand the caution to actually, you know, push it out there once you have an approved plan. So, and I think, you know, we definitely see that trend.
Yeah, I mean, I couldn't say it any better. I mean, that would be my consultant response too, is, you know, get all as far as you can without having to sign it yet, right? In case there are modifications that are required. And you know, what I'm about to say reflects my views only, not necessarily those of the network. But given the conversations that I've been in, Cheryl, with you and your teams, like I'm not getting that there's going to be oh no, you can't do that. Right? Like, that's the wrong comprehensive prevention services system. I just can't imagine they're going to get that, like, start over. So, I would imagine that you're probably going to be pretty close to knowing the layout of your system by the time you submit, and you can start.
I would agree with that. To some degree, counties are building from where they are. So there are a lot of things in the plan that I would hope are not new, so they have some place to put the stake to start with these services. And whether they had an approved plan or not, it would seem services that you would want to deliver anyway, you know? So.
Yeah. And that's the other thing I was thinking about is I, as I was listening to the question, is exactly that, Cheryl, which is like, this is the time where we could do the things that we had hoped to do when we looked at all those files and said, if we could adjust with, if we just done that with that family, if we could have just done that with that group of folks, they wouldn't have come into the system, right? This is the opportunity, right? So might as well start and start piecing together the funding for it. You're already doing some of it. All right, and what's the next question? Do we have another question, or?
We do.
Okay.
The next question is, should the CPP have recommended interventions for each tier of prevention, and should it each have EBPs made available?
So, Cheryl, I know you did mention this, but this is one of those things that bears repeating as many times as the question gets asked. So does it have to be one primary EBP, one secondary EBP, one tertiary EBP?
No, we're not requiring that you have an EBP in each tier. We're just asking that you have an EBP in your comprehensive prevention plan. You will want something that's working that you're going to be providing to the community. So you want to indicate that in your plan. And I would imagine some of those kinds of questions are probably coming from smaller and mid-sized counties. They had some concerns about, whether they had capacity to implement a lot of the EBPs, but you don't have to have an EBP in here.
All right. Next question.
Let's see. So far, this might be the last question I'm seeing. What I see is, can counties amend and resubmit their CPP at any point throughout the 3 years?
Yes, so there's flexibility to amend, and we'll probably issue instructions about that as well as our guidance comes out based on the plans that we get in. But similarly, if we make changes to our plan, once it's submitted to the federal government, we're allowed to amend our plan at any time. So it's an iterative process, and it's a flow basis. And if there are things that need to be changed, then we're going to be flexible with receiving those kinds of amendments.
Yeah, from an implementation perspective, any plan should be revisited every 1 to 2 years anyway. Your charter for your governance group, right? It's going to evolve. You're going to add folks. It's going to take on different roles and responsibilities as you move through implementation. That has to get revisited. So an annual replanning, just to take a look at everything and say, we're still on track. Do we want to course correct? Highly recommended. Right. Any other questions?
Looks like there's a last question, and this is from a collaborative county. How does oneself continue engaging the county to come to the table without it coming across as self-serving? Delicate balance, not creating a conflict for RFP process.
Jen, you want to take a stab at that one?
Will you one more time just kind of describe? It's a collaborative group of counties.
This is they said, coming from a very collaborative county.
Oh.
How does oneself continue engaging the county to come to the table without it coming across as self-serving? Delicate balance, not creating a conflict for RFP process.
Yeah, there's a lot of delicate balance on the RFP side, right? Especially with providers that potentially will apply. I think the self-serving part, right? The collaborative nature of a comprehensive prevention plan is making sure that it meets the needs of everybody in the county, right? That we are collectively trying to collaborate to prevent abuse and neglect. Let's go all the way on the primary side, right? And then we're collaborating to try to address the needs of kids and families when there is incidents of abuse and neglect. And so long across the country, child welfare has carried the weight of that solely, oftentimes, right? And this is a federal initiative, federal guidance to say, do not keep this in the helm of one state agency, but work your way through your entire group of participants who have money, who have resources, who have investment in their counties and in their state to try to figure out how you're going to work together to really address the needs of the communities that we know, if not addressed, abuse and neglect is oftentimes another contributing factor. So I think there's so much collaboration that's needed to help people understand that the transformation here across the nation is broadening the scope of what we collaboratively can do and addressing and pooling resources and commitment so that we can, really get there and we can help the communities in this intentional way.
Yeah.
It's a unique.
I would,
Yeah, and Dana, I was gonna throw this to you too, Dana, because like collaboration and walking a line along folks is like a KC value in itself. What would you say?
well, I think that our provider community and our partners have a lot of data and information about the populations that the CPP is intended to serve. And so providing that sort of data and experience, is helpful, right? Especially if the service you're providing is geared towards the target population that the county has identified. And then I would also say that provider agencies and collaborative agencies have access to community members in ways that agencies don't, right? They're trusted people in the community, and they can serve as a conduit and a liaison to bring those community members to the table. So I would think about your role as different than provider, but at one that can provide data and information and can provide access to communities in ways that county government doesn't have.
No. And Dana, I want to just uplift one piece of what you said and amplify it, which is if you start the conversation at what services do we need, you're going to go awry. If you come to the table with, here's our target population, our crisply articulated target population, and here's what either they've told us they need, now what services should we bring to bear, or how can you help us get to this target population? But without knowing your target population, you're going to be swimming in data. You're going to be swimming in service arrays, like various scenarios of service arrays, and you're not going to know how to nail it down. So come to the conversation with the who. Right. I don't see any other questions in the chat. I do see a lot of thank yous, Dana and Cheryl, for the resources. I suspect that, given I've talked with many of you all at different parts of your journey, and I hope that you have now a library, right? Somewhere you can go. You're going to have to watch some of this stuff over because it's not going to it wouldn't have made sense when we presented it to you. given where you are now. You actually have a context for it, right? So start to think about what, now that you have some more time, how are you going to leverage some of those resources? And we will take what you've shared with us back, and make sure that we tailor 2023 to be most supportive. Dana, what would, we'll let you have the last word here, because sort of, without your thought partnership, and of course there's the resources, but really without your thought partnership like this, none of this would have gotten birthed. So will you send us away for 2022?
Well, I will send us away first with a thank you for the interest and participation from the counties. Your participation has made, and your feedback really has made this series what it is. And I guess I would say that, and it's been said already, but there is no turning on the switch. Right? You're not going to turn on the switch to your CPP. You're going to work your way into a new way of doing business and a new way of thinking about how it is that you serve children and families in their communities with their families. This isn't a standalone, but it is an opportunity to begin expanding the types of services that you want for your children and families. And we hope that the resources that we have provided in collaboration and in addition to the resources that are being provided by Caltrin and Chapin and CDSS and other folks really provide a supportive infrastructure for you to pull from in developing your CPP. As Kush said, we're looking to taking all of the feedback that you've given us over the course of this last 6 months to tailor and develop a learning series next year that will continue to provide information, guidance, consultation, and technical assistance. So good luck. We look forward to seeing you in 2023. And we know that you're going to put together a fabulous plan.
With that, goodbye and have a wonderful holiday season all.